Hello, I'm Leah Anderson, the publisher of two neighborhood magazines here in Richmond. And they are Windsor Living, which is for the Windsor Farms neighborhood, and Salisbury Life for the Salisbury and Rosemont neighborhoods. And one of our sponsors for Windsor Living is our great partner, Orthopedic Physical Therapy. We're so proud and happy to have them on an interview with us this morning. And specifically, we are featuring Dr. Charles Brooks Steadman. And I'd like to tell you a little bit about his background, which is very impressive. Dr. Steadman received his BA degree in both biology and sociology from Bucknell University in 2006. And while at Bucknell, he swam at the varsity level, competing in mid-distance and distance freestyle. He received his doctorate of physical therapy from the University of St. Augustine for Health Sciences in 2011. And after PT school, he received recognition of his advanced orthopedic skills and understanding by achieving a manual therapy certification, NTC, on November of 2012. He received international postgraduate certification in dry needling by Mayo Payne Seminars and Janet G. Travell, MD Seminar Series in July 2014. And he was the first physical therapist in Virginia to be recognized as a certified cervical and temporomandibular therapist by the Physical Therapy Board of Craniofacial and Cervical Therapeutics. He effectively utilizes a variety of advanced manual techniques to improve the functioning of the jaw and neck in relation to the musculoskeletal concerns of the whole body. Brooks enjoys treating patients with complicated and or chronic orthopedic dysfunctions throughout the body. He utilizes the SFMA evaluative tools to treat the body as a whole. And Dr. Steadman is direct access certified. So Dr. Steadman, welcome to the program. I'm so happy to be interviewing you today. How are you doing?
I'm great. Thanks for having me. This is exciting.
Yeah, fantastic. Well, we've been looking forward to this for a while. So just wanted to ask you a few questions that would help our readers and our viewers get to know you better and get to know your expertise. I understand that you are a Richmond native and you've been treating orthopedic issues as a physical therapist since 2012. What sets you apart and your team apart from the other practices in town?
Yeah, thanks, Leah. I am from Richmond, and I'm happy to be able to help out my hometown. There are 7 physical therapists at Orthopedic Physical Therapy, and we all enjoy treating patients with a wide variety of issues, utilizing hands-on techniques in addition to therapeutic exercise and functional activities. But what's really nice is the ability to treat our patients one-on-one for the whole treatment time. That allows a lot of time to get to know our patients and figure out the details that might help with some of the more complicated issues. We enjoy, like I said, treating a lot of different issues. We do have some specialties that allow us to help some of the more complicated issues. We have a pelvic floor specialist. We have a hypermobility or EDS specialist. One of the first dry needlers in the state. She actually teaches dry needling all over the country. And then, yes, I do specialize in dysfunctions of the head, neck, and jaw.
Okay, wow, what a team. Very impressive. Well, great. It's good to get to know you all better and all the expertise that you provide in this market. So you mentioned that you have your own specialties, all the staff members, and that yours is treating the jaw and neck related issues. And you were recently the first physical therapist in Virginia to become certified cervical and temporomandibular therapist. Tell me a little bit about that.
Yeah, that's right. It's exciting. I've been working pretty hard on that for, I guess, about the last 6 years. The CCTT, or Certified Cervical and Craniomandibular Therapist, it's always a mouthful.
Yes, it is.
Yeah, there's the organization, it's the Physical Therapy Board of Cervical and Craniofacial Therapeutics. That's the organization that tests and certifies physical therapists with advanced clinical experience and training recognizing the specific treatment of cervical spine disorders, various types of headaches, oral-facial pain, or temporomandibular disorders. And, this area of physical therapy or dysfunction, all those areas are commonly, connected in some way. But unfortunately, there aren't many therapists that are, specifically trained in treating this area, dealing with those types of dysfunctions. And this is an area that really can get better with physical therapy. So I'm excited to be able to help people with this.
Wow, that is exciting. And I know there are going to be a lot of viewers who are very excited to hear this, that there is someone in
Excellent.
our market who specializes in these areas. Um, so now, what would you want a prospective patient to know about physical therapy, or how could you help them?
So physical therapy is the empowerment professional in the healthcare team. We can actually provide the information and the tools for the patient to actively take part in improving their situation. If you have questions about how to improve your function, if you have pain, if you're not moving well or a nagging issue, or if you want to prevent having a problem in the future, physical therapy can likely help with that. Seek out a skilled physical therapist in that area. And, it's a good way to improve that situation. We specialize in orthopedic issues, and not just orthopedic issues that have just occurred, also some of the issues that maybe have been going on for a longer period, or if you've had physical therapy elsewhere and it didn't really work out, that's where we really shine. Yeah, that's what I would say. Let us know how we can help you with some of those issues.
Right, right. So in other words, don't give up because you may have not had a full experience before, or may have not felt as much healing as you hoped, right?
Yeah, we're gonna make sure that we listen to you to find out not just the source of your pain, but the cause of dysfunction, so that we can best give you the information and the tools and help you resolve that issue.
Okay, fantastic. Yeah. So how would someone know if they could benefit from physical therapy?
Uh, I guess kind of a simple way is if you have pain with movement or without movement related to an activity or a position, then physical therapy can likely help. If you want to move, feel, or perform better in a new activity or pursuit, let us help.
Hmm. Okay, great, great. So you have to be in touch with your feelings, right? You have to be in touch with where the pain is, right?
There's a lot of connections.
Okay. So how can patients find you all?
So we're located in Richmond Medical Park, just outside of the Willow Lawn area. You can check us out on Facebook or look us up online at www.orthopedicptinc.com.
Okay, easy enough. Well, I really thank you for being a part of our program today, Brooks. And I know that there are a lot of people who are going to appreciate everything that you have to offer to them. And I'm sure that you're looking forward to those relationships and using your skills and your knowledge to benefit those folks. So
Yeah,
thank you.
absolutely. Thanks for having me.
All right. Have a great day.
You too.